Well, I'd like to welcome everyone to UNC virtually for our second year in a row of virtual resident interviews. I'm Dale Yarbrough, Department Chair of Otolaryngology, Head and Neck Surgery. What you see on the screen there is our medical complex. I just want to highlight a few things about the complex and about the program. First of all, this is what will be coming during the time that you will be here. This is our new surgical and ICU tower. This is a sketch, but we do have steel out of the ground for all 6 floors right now. This will be a state-of-the-art building, and it's really going to be a huge addition for us in otolaryngology. Some of our other sites are our clinic at Meadowmont, which is conveniently located next to a Five Guys. For dining pleasure. This is our cancer clinic, which is located on the 2nd floor of this state-of-the-art building that you see on the left. The entrance is on the right. And some of our leadership you can see mentioned here. I'm not going to go through all of these one by one. But you will meet all of these people during your interview day. These are our vice chairs. And I just want to give a little bit of history about some things that you may want to know about the University of North Carolina at Chapel Hill. In 1952, Dr. Fisher established otolaryngology at the newly formed School of Medicine. And in 2001, ENT became a department under the leadership of Dr. Pillsbury. I came in 2018 as the 3rd chair of Otolaryngology Head and Neck Surgery. And we have been ranked since 2015 in the top 50 for US News and World Report. Related to research funding, we've done very well as an institute and also in the Department of Otolaryngology Head and Neck Surgery. In 2020, the Head and Neck Surgery Department ranked 21st and the School of Medicine 17th for NIH funding. And in 2020, UNC ranked 6th overall for federal research funding with $1.15 billion in sponsored research, and this year so far is outpacing last year. The School of Medicine is the majority of that with more than $500 million in funding. And in 2018, the UNC ranked 99th percentile nationally for federal research grants. So like many of the institutions that you come from, UNC is a true academic medical center. There's 6 divisions in otolaryngology, head and neck surgery. You can see them all there. They all have multiple faculty members, and I'll briefly go through these so that you'll be a little familiar with them as you meet people. The Division of Facial Plastic and Reconstructive Surgery has Dr. Madison Clark as the division chief, and Matt Miller is our newly added facial plastic surgeon. Dr. Clark took over from Dr. Shockley. Many of you may be familiar with him, and Dr. Shockley is still around in a teaching role. This division does very complex surgeries, as you can see at the bottom right, with one of the first medial femoral condyle flaps done in the United States for a total nasal reconstruction, but also very fine and delicate cosmetic work, as you can see in the upper with the rhinoplasty. This is a very busy and growing division, and residents usually have a great experience working in this division. Dr. Miller has come to expand our facial nerve center and has gotten off to a tremendous start. The Division of Head and Neck Oncology is a large division. You can see here, Dr. Patel is the division chief. Dr. Shrank is the newest faculty member, and we have 2 APPs, Katie Vogler and Ron Algood, who have recently been added to the team. This division is also very busy with about 200 microvascular flaps per year, a lot of minimally invasive salivary procedures. And this is a team of surgeons that works with medical oncology, radiation oncology, and other providers to provide multidisciplinary care. The multidisciplinary tumor board is well attended and always engaging. There's a lot of trials and grants in this division, and the robotic surgery program is expanding, as well as the facial, in conjunction with Dr. Miller, the facial reanimation surgery. And you'll probably notice with several of our divisions, there's a lot of collaboration between divisions as well. The Otology-Neurotology and skull-based surgery division is shown here. Dr. Brown is the division chief, and Dr. Selleck's the newest addition. Dr. Dedman's been here for several years. And on the right, you can see an image from our laboratory work that won a prize for, recently won a prize for art in medicine. This division is nationally and worldwide recognized. You can see it's very busy as well with the 2021 cochlear implant that was done in the year 2021, just this year. So we're celebrating that. A lot of skull-based surgery also is mentioned there. But the prominence of the program is really indicated by meetings that they are asked to host, including the International Hearing Meeting, as well as the International Conference on Cochlear Implants and Other Implant Technologies. So once again, a very busy division and a growing division. Pediatric Otolaryngology is represented here with the faculty members that are on there. Dr. Zdansky is our division chief. Dr. Drake's also a longstanding member in this division and is a vice chair and also executive associate dean in the School of Medicine. And Dr. Duty's the newest addition. This is a busy division, a common theme amongst all our divisions, with a lot of operative cases and a lot of involvement in multidisciplinary teams that you can see listed there. I'll mention just a few. The craniofacial team, which is one of the oldest in the nation, is led by Dr. Drake. But you can see this is a very engaged team and works in a lot of multidisciplinary settings. Recently, Pediatric Otolaryngology expanded to a clinic in Raleigh that is getting off the ground. The pandemic has been pretty tough, especially with pediatric patients, but that clinic is growing. The division of Rhinology, Allergy, and Endoscopic skull-based surgery is shown here with their members. Dr. Senior is the division chief. Other members have been long-standing, with Dr. Kemple being the newest addition. Once again, a very busy division with a large surgical volume, a lot of skull-based cases that you can see highlighted there. And on the right, pericranial flap being passed down endoscopically into the nose for reconstruction. And a lot of divisional research with involvement of learners in most all of the research that the division does. General Otolaryngology is represented by Doris Lynn and Christy DeMason. Dr. DeMason is our division chief. This division, along with Dr. Hackman in the head and neck division, has a focus on sleep surgery, and I think has performed more than 60 Inspire procedures, which is indicated there on the left. This division also is expanding into the community. Right now, there's a clinic that's shown here in Pittsburgh, but a very engaged division. Voice and swallowing is represented by people that you probably recognize. Dr. Buckmeyer, who's the division chief, but also our program director, and Dr. Shah, who's associate program director. And I failed to mention under Rhinology, Dr. Ebert is also an associate program director. So you'll know those people very well. Once again, this is a very busy division, runs the Voice Center with a lot of office-based procedures. More and more of their work is turning into office procedures. You can see on the left some laser procedures being done in the office. And you can see that there's a lot of vocal fold injections as well as laryngeal laser procedures done in this division. This division also is responsible for a lot of open and endoscopic airway procedures that are done in the main hospital. And you can see they're also engaged in education of trainees with a lot of presentations by trainees in the last 5 years. And one of our interns, Dr. Gaki, shown on the left with Dr. Buckmeyer and Dr. Shaw. Wake Med is our outlying rotation for residents. You can see the providers that are at Wake Med at the top, led by Dr. Ferguson, and the complex, the Wake Med medical complex is at the bottom. We have a vibrant and large research faculty. You can see here, a lot of the research is focused on audiology, but also there's research focused in head and neck cancer and epidemiology. Some of the highlights from the research division, you can see on the left, a lot of research grant funding, including clinical trials, and these exclude clinical trials through the head and neck division, which will run through the Lineberger Cancer Center, but also with a lot of federal grants, 21 in total. And you can see in the bottom the breakdown with mostly being RO1s, but some training grants, some K grants, and U grants included in there as well. You can see on the right some of the work that's done in these labs. A lot of work related to cochlear physiology and cochlear implantation, some behavioral studies as well, and mechanistic studies for auditory processing. In the head and neck oncology lab, some projects focused on prognostication as well as demethylation therapy. This slide just represents the total number of papers that have been published over the last year, with the total amount of research funding, which ranked us through the Blue Ridge ranking at 21st this year, up about 4 or 5 positions from the year before. So the research enterprise is growing. Here are just another highlight of the different categories of research funding and the growth between fiscal year 20 and 21. So we have a very active research division that is growing, and it's easy for learners and trainees, residents to get involved in these research projects. So that's really all I have to share with you. I want to welcome you once again to UNC. I hope this overview has been useful, and I'll pass it along to the next presenter.